So the GEM-Claridex clinical trial, it's a study run by the Spanish myeloma group. It's performed in patients with myeloma non-candidates for autologous stem cell transplantation, and we have included 286 patients that are randomized 1-to-1 to Lenalidomide and Dexamethasone, or Lenalidomide, Dexamethasone plus Clarithromycin. So patients receive the treatment until progression or unacceptable toxicity, and Clarithromycin is given 500 milligrams twice a day. RD is given in the usual dosage and administration. So the characteristics of the patients are the usual ones that we see in patients, in elderly patients with myeloma, but I have to say that more than half of the patients were more than 75 years old. So what we have seen is that the response rate obtained in the experimental arm has been significantly higher in terms of CR and very good partial response as compared to the control arm. But surprisingly, this is not translated in a better progression-free survival. So we decided to divide the progression-free survival between younger and elderly patients, and we saw that in young patients the results were superimposable, but in elderly patients, so the addition of clarithromycin was almost deleterious. What was the reason for this? So the reason for this was a significantly higher percentage of infections in the experimental arm, mainly pneumonia, that will explain these results. So then, we analyzed the overall survival, and we have not seen differences in the two arms. And so I would say that in conclusion, so the addition of clarithromycin to RD seems to increase the response rates, but this does not translate in a better progression-free survival, mainly due to toxic deaths. And so clarithromycin could be used then in the youngest between the elderly population, that is in patients less than 75 years old, and probably with anti-infectious prophylaxis as well as with dose modifications. We have attributed this higher toxicity to the well-known effect of clarithromycin in the metabolism of corticosteroids, since they seem to increase the area under the curve of the steroids in general.